Welcome back to another tutorial of the skeletal system. Today I'll be discussing the inferior appendicular skeleton. Okay, the inferior appendicular skeleton includes the pectoral girdle, left and right femur, left and right tibia, left and right fibula, as well as the feet and the bones that include the feet. Because I've discussed the pectoral girdle in a previous lesson, we're going to jump right to the femur. Okay, so here I have the right femur. This is the anterior view of the femur. We have a few structures that we need to know here. The first structure is the head of the femur, so the femoral head. Okay. And then if I look at the medial aspect, the most medial aspect of that, so the head makes up the medial side, there is this little divot in here. This is known as the fovea capitis. Fovea capitis. And its job is to articulate and secure the femur into the acetabulum here. Okay, and so within the coxal bone. And so there'll be a piece of ligament that will stick right into here, and there'll be another depression within the acetabulum of the coxal bone, which will secure the femur, the femoral head within. The next structure I'd like to talk about is the neck of the femur. Okay, the neck. So it's a bit longer than the neck of the humerus. The next structure here on the lateralmost aspect here is the greater trochanter, And you can see that on both sides, the anterior side as well as the posterior side, the greater trochanter. And then just below that, we have the lesser trochanter. And both of these together will be the site of attachment for a lot of muscles that originate from within the gluteal area. So coming off of the ilium, there'll be a muscle that attaches here. Coming off of the sacrum, we'll have some muscular attachment. And this will allow us to lift our leg laterally and also do a rotation as well. Okay, so we'll be able to allow us to lift our leg, particularly a little bit more posterior, and then a rotation. Okay. If we move further down along the posterior side of the femur, you can see this line, this ridge here, and at that junction of that ridge is called the gluteal tuberosity. Gluteal tuberosity. So it's a lengthened elevation here, and this is going to be the site for our gluteal muscle attachment, and this is going to allow to lift yourself up. So when your leg is flexed as if to climb stairs or a mountain, in that flexed state, it'll give you a power pull which will elevate your body to extend your leg once again. So this will be the site for your gluteal muscle attachment, and it works primarily when you are trying to climb stairs or when you are running. It's generally inactive when you are simply walking and standing. Okay, the next structure I'd like to look at, moving down more inferiorly here. Okay, this structure on this side is known as the medial condyle. Medial condyle. Okay, so let me zoom out a little bit here. So remember, the head is on the medial side, and then a condyle is a rounded, very smooth surface that allows for articulation with another bone, and generally speaking, it's going to allow a nice smooth movement during flexion, extension, or just moving within a joint. So we have the medial condyle here. Okay, and then on the other side, this is known as the lateral condyle. Again, on the trochanter side, the greater trochanter side, this would be the lateral aspect. So this would be our lateral condyle. Lateral condyle. Okay. And then over to the side here, Okay, on the medial side again, we have a medial epicondyle. So an epicondyle, like we learned within the humerus, an epicondyle will generally be outside of a condyle. Okay, so this is our condyle, and then this is our epi outside of the condyle, medial. And likewise, we will also have a lateral epicondyle, okay? Another structure that I would like for you to know, okay, so again, we are on the posterior side here. In between the two condyles, we have an intercondylar fossa, okay, and that's right in here. Okay, you can see there's a groove within, okay? All right, and that is our femur. Now we'll be discussing the tibia, which is just distal to our femur, okay? You can see here that I've left the patella on, and the patella really doesn't articulate tightly with either of these bones. However, there will be a ligament that will be attaching or will secure this patella from the anterior side of the femur, right about here, sort of right around here, and then the other end of the ligament attachment will be on this site right here. Okay, so here is the tibia. A few structures that we should look at in order to determine our lefts and rights and also orient ourselves is this first structure. This is on the anterior side. I talked about it a little earlier. This is where our patella will be anchored using a ligament. This is the tibial tuberosity. So it's on the anterior side. You got that bump. You can actually feel that if you touch just below your knee. It kind of juts out quite a bit. All right, so you'll have a ligament attaching there, and then on the posterior end, it sort of curves inward. Okay. All right, and then just above this, we have our we have two facets, okay? So this will be some additional cartilaginous material or padding that sits on top of our tibia. This is the medial side, medial facet, and this is the lateral facet, okay? So this is going to be the site where your femur will sit. The two condyles of the femur will sit. Okay, so in between our two facets for the condyle, the femoral condyles, we have this groove that exists. So I'm going to move this away a little bit and turn it more toward us. Oops. Okay, and there's this little divot that exists in between, so it's almost perfectly on the superiormost portion. This is called the intercondylar eminence here. Okay, all right, now let's move further down. Another structure to know down here is our medial malleolus. So our tibia is a medial leg bone. Okay, so this is our medial malleolus. So this is going to form our ankle. Okay, so if this is the medial side and this is a medial bone, which tibia is it? Our left tibia. There we go. Okay, next we're going to be talking about the fibula. Okay, so here's the fibula here. Of the fibula, we are going to be looking at the fibular head and the lateral malleolus. These are some structures that we need to know, not too much. But in addition, we're also going to be looking at a few of the tarsal bones that I would like for you to know where our tibia and fibula sit. We can see up here, we have, this is the fibular head, and the fibular head articulates just underneath the lateral side of our tibia here. Okay. Another fact here is that we have a muscle that will articulate onto the head of the fibula, and this is going to allow for us to rotate our leg to the side. So anytime we want to turn our foot out, it's also going to allow us to that articulation site, it's going to allow us to flex our foot, so point our foot upward or our toe upward. Another structure that is important to know is the lower part here, okay? And this is the most distal point of our fibula, and this is called the lateral malleolus. So this forms the outside ankle bone, okay, the lateral malleolus. And the lateral malleolus will articulate with the talus here. So the talus is the first of our tarsal bones that I would like for you to know, okay, the talus. So this is going to be a weight-bearing tarsal bone. Okay, so actually both our tibia and fibula will sit on the talus bone. Okay, and then the last tarsal bone that I'd like for you to know is the calcaneus. So this is a really large ankle bone. Okay, calcaneus. So our calcaneus, forms our heel. Okay, it's the posterior most part of our tarsal bones. Okay, all right, and that is it for the structures that we need to know. All right, so stay tuned, and I'm going to show you, give you an opportunity to earn some extra credit here. Okay, so if you can learn the tarsal bones, we have 7 tarsal bones. We already need to know 2 of the 7, so there's 5 more tarsal bones to learn. All right, let's begin. Talus, calcaneus. Up here, in front of the talus, is the navicular. Okay, and then the lateral most one is the cuboid, lateral cuneiform, intermediate cuneiform, and the medial cuneiform. Okay, so that makes up the tarsal bones. Okay, and that is it for our tutorial of the inferior appendicular skeleton. Thank you for watching.